Okay, so this question is often asked: what is the difference between a psychiatrist and a psychologist? So let's try and address this in this video. And nowadays, the most common thing that people do is to go on Google or any other search engine and find out what the differences are. And if you do that, one of the most common things would that come out to answer this question is about the fact that psychiatrists are medical doctors and go to the medical school and are able to prescribe medications, whereas the psychologists cannot. And that might be the fundamental difference. But when we are talking about psychiatric conditions and mental health conditions, it is much, much more beyond the differences. But I think what is more important is that at what point in a patient's journey, or for that matter, for any other mental health condition, who and what intervention is most important. There are times when psychological interventions become very, very important. And then there are equally times when the use of medications becomes very, very crucial before looking at psychological interventions. So, when we are talking about the differences, one of the essential things also to understand is the approach that an individual professional takes towards understanding the person's mental health condition, or for that matter, whatever problems they are having. For example, when it comes to psychiatrists, and me being a psychiatrist, how I would approach or think about an individual's problems are based on multiple factors, which may include biological factors, they may include psychological factors, may include social factors that are influencing a person's difficulties. There may be lifestyle changes, there may be nutritional changes, there may be sleep related conditions, there may be other medical health conditions. So there's a host of things that I would be thinking when I would be approaching a person's mental health difficulties and working out a personalized plan for the treatment for their conditions. Whereas when we think about psychology, psychological approach would generally be not strictly speaking based on the diagnostic classifications that we use in psychiatry, but they may be used in terms of what the main problems that individual is facing and how we can conceptualize their problems from a psychological framework. Uh, for example, CBT, or someone has a problem with trauma, and then we are looking at trauma focused cognitive behavioral therapy, or EMDR. So the psychological models are then used to understand and help the individual for their problems. So you can see that in certain conditions, it may be very important that psychological interventions are added in. And what also becomes important is at what phase of the person's difficulties are these interventions put in place. For example, someone who is very severely depressed, at that point, it would be much, much beneficial for them to have a psychiatric review and use of medications or other neuromodulatory techniques so that they are well enough to then engage in psychological interventions, which may take various forms of CBT or its offshoots. So instead of looking at trying to find the differences between psychiatrists or psychologists, one has to understand how these professionals work together and at what point in the patient's journey do they become important to try and help and improve the person's condition. And if you think you found this video helpful and the explanations useful, please do not forget to press that like button, subscribe to the channel, comment, share the video, and engage with me so that I can get more and more content out to you to help you with your mental health. And please also do not forget to press that bell button icon, because that way you will be notified for all the upcoming videos on this channel. So see you up until next time.